Hello everyone and welcome to AIS Facebook um, platform again, and it's good to have an interaction with all of you after a bit of a long time. And as I mentioned in my some previous recent talk that Ayurveda is getting more and more on a serious level in this part of the world, so hence I thought I will bring up some more deeper pathologies and deeper understanding for those who are into Ayurveda or are keen to learn Ayurveda on a more deeper level. So today I am going to bring up one major concept of Ama and Amavish. So what is the difference between these two, and how as a Ayurvedic practitioner, no matter whatever level you are, how you can diagnose it, and then what is the line of treatment, what kind of ailments these two can form. Now, when we talk about ama, everyone understands from Ayurvedic concept that this is our primary focus to identify when a client comes to us, that how is their body is producing any ama. So ama is that undigested substance which get formed due to the agni situation, and it is there what we call as putrid morbid substance which will be in the gut, and it happen at a first level of our problem when due to incompatible lifestyle, incompatible diet, various incompatible environmental factor of work and where the person living, and then lot of mental and emotional issues of the current state or long standing what we call as suppressed emotion. So they all will then impact on one or the other dosha, and when dosha get impacted, your agni will get impacted, and that will produce what we call as ama at a first stage. And that ama, as I mentioned, will be that putrid, undigested food mass which will sit in the gastrointestinal tract. Now it will give you various kind of symptoms that can be just one very common thing everyone want to look at. Look at the tongue. There will be a coating, and that coating can be of different color depending upon the different doshas dominance, and then person will start feeling a bit of fatigue, tired, still keep working, and all that sort of things are happening and can be treated in a simple way. But now when that ama start moving into the microchannels, what we call as shrotas in our body, and start getting more affected. Affected means, in a simple way to understand, when it start getting fermented, not being eliminated, not being burned out with whatever the treatment someone is giving, but itself start getting more and more fermented at a cellular level, and then it start mixing with the different dhatus. So say for example, it mix with the rakta dhatu, it will be bound to cause like autoimmune disorders from our Western perspective. If it is gone to the maja dhatu, it will give you a lot of neurological disorders of different gradations, neuropathies sort of issues can happen, numbness is happening, twitching happening, so many issues can come up, musculoskeletal issues can come up, neurological disorders can happen, which we talk about from the Western perspective. So all those ailments are now due to that Amavish. This is where we talk about that Amavish stage is a very serious stage and sometimes very difficult to treat because that state does not get treated with simple herbs or simple lifestyle changes. For that, practitioner must be well equipped to identify that what is the stage of that ama. Has it gone to the Amavish? And then if it has gone to the Amavish stage, up to what dhatu it has gone and what doshas involvement, say Amavish get involved with the pitta, then more inflammatory, vascular inflammations can happen. So in those line of treatments are also very deeper, stronger and longer. Sometimes certain problem might have manifested to that level that it will be irreversible. So one has to be very careful, and at the same time this message is that all who are interested in Ayurveda, they can very confidently can understand that Ayurveda can treat your any serious ailment, no matter whatever deeper level of problems has come up. Some might have a serious issue that their memory loss is happening to the different gradations, then their speech has started getting a bit stutter. Sometime before it you lose your speech totally, these are the indication. Then your limb, you won't be having a good coordination, you cannot work, you feel very weak in your bones suddenly. So these are all signs and symptom of that your body is now having Amavish, that more deeper toxin stage, toxicity of the ama, you can say. So that what need to be looked at. Now for this, many people will try to go and get Panchkarma treatment done, which is one of the most profound Ayurvedic detox and rejuvenation program. But then for that they will say that, okay, I can travel to India, I can get a treatment done there, and then also I can visit India and look at different places. That is where they make the big mistake, because when they are in an Amavish state, traveling is always going to be a bit more difficult. And when you are having those treatment, and then after those treatment, whether you have a 30 days treatment Panchkarma or 21 days Panchkarma, if you have not followed the Sansarjan karma diet and planning and lifestyle, your ama never going to get eliminated from deep level. And at the same time, when you are traveling back and you got back into your old routines, whether you are eating heavy processed meat again, whether you are into alcohol, whether you are into drugs or coffee or those kind of things, then it means your body has not yet stabilized, and your body will start building more ama, and that ama will be directly going more onto the deeper level. So just to be more careful that how your life is, but at the same time to those practitioners who are practicing Ayurveda, very word of caution that if you found that your client has an Amavish state, don't try to treat them. Try to refer to, you can refer to them to the advanced diploma practitioner with more experience, and then not that I will say that all Ayurvedic doctors even will understand Amavish. That is where the problems are. Most of these current Ayurvedic doctors mostly have the understanding from the Western medicine's perspective, but their own understanding on Ayurveda is a little bit compromised. So be careful when you refer or go to the practitioner. Look for more serious and experienced Ayurvedic practitioners, and you can definitely get much more better outcome. Ayurveda can help you as long as you follow the right treatment program and plan, and then you are committed to get better. Thanks everyone.